Hello, my name is Shanine Richard, and today I'll be teaching you about important precautions during pregnancy to help you and your baby stay safe. First things we're going to go over is what foods to avoid. Certain foods should be avoided during pregnancy because they can harm you and your baby. Raw or undercooked meats, fish, raw eggs may carry bacteria or parasites. Unpasteurized milk and cheese can contain listeria. Deli meats and hot dogs should be heated until steaming to reduce risk of infection. Fish high in mercury like shark, swordfish, king mackerel, and towfish should be avoided because mercury can affect the baby's brain development. Now, over-the-counter medications. What over-the-counter medications and supplements can a pregnant woman take? So some over-the-counter medications are safe, but others should be avoided. Acetaminophen or Tylenol can be used for pain or fever, but you should avoid ibuprofen and aspirin unless it's prescribed by your primary care provider because these can affect the baby's heart and circulation. For allergies, certain antihistamines like Loratadine may be safe, but decongestants like Sudafed should be avoided. Prenatal vitamins with folic acid and iron are recommended, but herbal supplements should be avoided. Unless your doctor deems it okay for you to take any other supplement. Because supplements aren't tested for safety by the FDA in pregnancy, so this could be harmful. Also, environmental exposure. Pregnant women should avoid harmful environments, exposures, so you should stay away from lead, paint, or dust, which can cause developmental issues. Avoid pesticides and harsh cleaning chemicals, which may be toxic. So when cleaning, have an open ventilation. You also want to limit exposure to radiation, such as unnecessary x-rays, because this can also harm the baby's growth. Alcohol and tobacco substances. Alcohol should be completely avoided during your pregnancy because it can cause fetal alcohol syndrome, leading to lifelong developmental issues. Tobacco use should also be avoided because this can increase the risk of low birth weight, premature birth, and breathing problems. Recreational drugs such as cocaine, methamphetamines, and or opiates can cause miscarriage, birth defects, and withdrawal symptoms in the newborn baby when born. So you want to avoid all those illicit drugs. You also want to have travel precautions. So the safest time to travel during the pregnancy is the second trimester. This is between weeks 14 and 28 when risks are the lowest. And that's why you want to travel during that time, because risks are the lowest. Prepare carrying medical records and knowing where hospitals are when you're traveling, because in an emergency you will want to know that. Avoid traveling in areas with disease outbreaks or poor medical care. It is not safe to travel late in pregnancy, especially in 36 weeks. Sitting for long periods of time can increase risk for blood clots. So stand, stretch, and walk around as much as possible every 2 hours and wear compression socks if needed. Dental care. So the best time to visit the dentist is during the second trimester as well. Routine dental procedures are safe and dental x-rays can be done with proper shielding. Common dental issues during pregnancy include gum swelling, bleeding of the teeth, and increased risk for cavities due to hormonal changes. Good oral hygiene is very important for both the mother and the baby. So now that we've gone through all these things to avoid during your pregnancy, you want to avoid being harmful and having harmful foods, unsafe medications, environmental exposures, and substances. By following travel and dental precautions, you can protect your health as well as your baby's health throughout your pregnancy. So please keep in mind these precautions, and I hope they are helpful. Thank you for listening to this instruction.